Dr. Claytor here with our gorgeous patient who's 52 years old, a year status post tummy tuck. Tell us what were your motivations? What inspired you to go down this pathway?
Basically, after 4 kids and menopause, I just kind of wanted to be back where I was before.
And you had tried what other things?
Oh, diet, exercise.
None of them were really
no.
helping you achieve that goal.
I mean, I lost some of the weight,
Yeah.
but not.
Didn't get that
flat.
contour.
Yeah.
Didn't get that flat.
Yeah.
And are you pretty athletic? Were you out jogging and riding a bike
Yeah,
and
at the gym.
and eating really well and just no movement?
Right.
What were some of the things that you were looking for in a surgeon?
Your personality was fabulous. Your staff was phenomenal.
We have great staff.
Like, they really were. They were all great, answered questions, super pleasant to deal with all around. But it was no drains. I didn't want drains.
Yeah.
And then just the way you talked me through everything, the blood clots, we don't have to worry about that, everything that I needed for that.
What she's mentioning is there is a small incidence of blood clots. So it can start in the leg as a deep venous vein thrombosis and migrate up to the lungs and give you a pulmonary embolus, which in certain cases, it could be the end of the line. I have come up with a protocol where we're injecting heparin before surgery. All through surgery, there are sequential compression devices on your legs. And then we set you home with sequential compression devices that you wore for 2 weeks. One day after surgery, you started giving yourself Lovenox injections, which is like a heparin, and you did that for a week. And the reason we do it for a week is that in the patients who do have blood clots, by far the majority of them are between post-op day 2 and post-op day 7. And so we find adding in those shots in that postoperative period, in addition to giving you a shot of heparin before you even go into the operating room, we protect you in the beginning and we protect you in the end, and then we combine it with that mechanical prophylaxis, which is causing that squeezing of your calves. Mechanical prophylaxis is so impressive that you could even put it on your arm and it would give you protection in your leg. So there's something systemically going on when you have that sequential compression devices going on. This combination treatment is very, very effective at preventing any kind of blood clots. So that's one thing, and thank you for bringing that up. And then no drains. We don't like to use drains. I haven't used them in like 17 years. I get invited all over the world to go and talk about this. And really many people are like, what's the purpose of the drains? Why do you need the drains? And we do 3 little maneuvers to ensure that you don't need drains. And one is we start out by liposuctioning, and that does what we call discontinuous undermining that allows me to lift and migrate all the tissue to be tightened. I preserve that layer of Scarpa's fascia, which is super thin. It's as thin as a piece of paper. It actually is part of your lymphatic channels. And so by preserving it, you're sort of keeping the sump pump of your abdomen intact. Traditionally, it was just ripped out, but we keep it. Third thing that I'm doing is I'm using very little cautery. Most of the dissection is done with a scalpel. The cautery is only when I come across a small blood vessel. And so we're using very little thermal injury on your tissue, and therefore you don't weep as much fluid. Like if you ever burned your finger on the stove, you get a little blister. So we use very little thermal energy when we're doing it, and so as a result, we get very little fluid being made. Last thing that we do is progressive tension sutures, and so if you imagine my shirt being lifted up as your stomach was lifted up, we put stitches to pull everything down, and it closes down that space, and it's much harder to accumulate any fluid when it's all been sutured closed. That's also a big part of accelerating your recovery. Were you up and walking around on the first post-op day?
Yeah.
Same day. And then we have you showering the next morning, let water run over everything, and then binder and a mark on there how tight to put it. Was it helpful knowing?
Yeah, that was really helpful.
It's very helpful. And these are these tiny little pearls that over the last 20, 25 years, you accumulate all these tiny little pearls. And so when people come in and say, oh, well, it's just a drainless, there's so many other little things that go into creating this entire experience that are just an accumulation of literally decades of experience to create this awesome result. So let's see your cute belly. Have you been on vacation this past summer?
Yeah, well, we went to the beach for a week.
And you broke out the bikini.
I did.
How did it feel?
Wonderful.
What we can see here, we've got beautiful central linear definition and beautiful shaped contours of her waistline, beautifully flat tummy, and gorgeous contours. And then your belly button looks just so cute. And then her scar is hidden down in her bikini line.
The pain was a little evil afterwards, but
Did you hate me for the first 3 days? I tell everybody, you're gonna hate me for the first 3 days. You slept in that flex position, so was it a little difficult the first couple of days?
Yeah, just getting used to.
Were you in a recliner or were you just in bed with pillows?
Like a pillow.
A lot of times people will do that. You got driven in on your first 1 week appointment. And did you get driven in on your second?
No, I drove.
You drove, and that's very, very common. They always want to know, well, when can I get back to my regular activity? And so one of my key indicators is when you're back driving yourself. By the second week, almost everybody is driving themselves.
Yeah.
And then boom, boom, you're back to recovery. And I do this graded at 1 week, you're 25%, 2 weeks, 50%, 3 weeks, 75%, and by a month, I let you do anything. Was that pretty true?
That was.
Here we are, maintained, very beautiful result at a year. I use 3 layers of sutures, 2 layers of permanent sutures that are never going anywhere. And then the top layer is absorbable. So if you ever feel a knot or something there, you're like, oh, don't worry, that one will dissolve away. But those 2 layers of permanent sutures, your core strength will not diminish and won't change. Do you feel like this has helped your core?
Oh yeah. Yeah, it's a big difference. I can tell I'm working out.
And very durable. There's nothing that I've prevented you from doing.
No, not at all.
If you go on the internet, Dr. Google and ChatGPT, they're like, oh, it's got to be months and months and weeks. No, at 1 month, you're back doing pretty much everything that you were doing before surgery. And these are permanent sutures. These are questions that don't often come up because that's a really nuanced thing that when you go in and you talk to your prospective surgeon, ask them what sutures they're going to use. Sometimes people use absorbable barbed sutures. I know that I want our patients at a year, 2 years, 5 years, 10 years to be coming back with this still super strong, tight belly. And I don't want to make them wait, 6 months. Oh, you can't do anything for 6 months. That's crazy. You want to get back and live your life. They want to be doing this activity soon, and they want to keep doing it for a long time. Final thing I like to ask everybody is this something that you would recommend to a friend?
Oh, absolutely.
Well, thank you so very much. It's
Thank
been a
you.
pleasure taking care of you.
Thank you very much.
Yeah.